Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Results after 4 years of screening for prostate cancer with PSA and MRI background. Data on the efficacy and safety of screening for prostate cancer with magnetic resonance imaging, MRI, are needed from studies of follow-up screening. Results. After a median follow-up of 3.9 years, approximately 26,000 person-years in each group, prostate cancer had been detected in 185 of the 6,575 men, 2.8%, in the MRI-targeted biopsy group, and 298 of the 6,578 men, 4.5%, in the systematic biopsy group. The relative risk of detecting clinically insignificant cancer in the MRI targeted biopsy group, as compared with the systematic biopsy group, was 0.43. 95% confidence interval, CI, 0.32 to 0.57, p less than 0.001, and was lower at repeat rounds of screening than in the first round. Relative risk, 0.25 versus 0.49. The relative risk of a diagnosis of clinically significant prostate cancer was 0.84. 95% CI, 0.66 to 1.07. The number of advanced or high-risk cancers detected by screening or as interval cancer was 15 in the MRI-targeted biopsy group and 23 in the systematic biopsy group. Relative risk, 0.65. 95% CI, 0.34 to 1.24. 5 severe adverse events occurred, 3 in the systematic biopsy group and 2 in the MRI-targeted biopsy group. Conclusions. In this trial, omitting biopsy in patients with negative MRI, results eliminated more than half of diagnoses of clinically insignificant prostate cancer, and the associated risk of having incurable cancer diagnosed at screening, or as interval cancer, was very low. Ziresovir in hospitalized infants with respiratory syncytial virus infection. Background. Respiratory syncytial virus, RSV, is a leading cause of severe illness in infants, with no effective treatment. Results of a phase 2 trial suggested that Ziresovir may have efficacy in the treatment of infants hospitalized with RSV infection. Results. The intention to treat population included 244 participants, and the safety population included 302. The reduction from baseline in the Wang bronchiolitis clinical score at day 3 was significantly greater with Ziresovir than with placebo, minus 3.4 points, 95% confidence interval, CI, minus 3.7 to minus 3.1, versus minus 2.7 points, 95% CI, minus 3.1 to minus 2.2. Difference, minus 0.8 points, 95% CI, minus 1.3 to minus 0.3. P equals 0.002. The reduction in the RSV viral load at day 5 was greater in the Ziresovir group than in the placebo group, minus 2.5 versus minus 1.9 log 10 copies per milliliter. Difference, minus 0.6 log 10 copies per milliliter, 95% CI, minus 1.1 to minus 0.2. Improvements were observed in prespecified subgroups, including in participants with a baseline bronchiolitis score of at least 8, and in those 6 months of age or younger. The incidence of adverse events related to the drug or placebo was 16% with Ziresovir and 13% with placebo. The most common adverse events that were assessed by the investigator as being related to the drug or placebo were diarrhea, in 4% and 2% of the participants, respectively, an elevated liver enzyme level, in 3% and 3%, respectively, and rash, in 2% and 1%. Resistance-associated mutations were identified in 15 participants, 9%, in the Ziresovir group. Conclusions. Ziresovir treatment reduced signs and symptoms of bronchiolitis in infants and young children hospitalized with RSV infection. No safety concerns were identified. Gene therapy, with Fidanacogene Elaparvovec in adults with Hemophilia B. Background. Fidanacogene Elaparvovec, an adeno-associated virus, AAV, gene therapy vector for Hemophilia B, containing a high-activity human factor IX variant, FixR338L/FixPadua, was associated with sustained factor IX activity in a phase 1/2a study. Results. Of 316 men who underwent screening for the lead-in study, 204, 64.6%, were not eligible. 188, 59.5%, of those were ineligible, owing to the presence of anti-A.I.O neutralizing antibodies. Of the 45 participants who received Fidanacogene Elaparvovec, 44 completed at least 15 months of follow-up. The annualized rate of bleeding for all bleeding episodes decreased by 71%, from 4.42, 95% confidence interval, CI, 1.80 to 7.05, at baseline to 1.28, 95% CI, 0.57 to 1.98, after gene therapy. A treatment difference of -3.15 episodes, 95% CI, -5.46 to -0.83, p equals 0.008. This result shows the non-inferiority and superiority of Fidanacogene Elaparvovec to prophylaxis. At 15 months, the mean factor IX activity was 26.9%, median 22.9%, range 1.9 to 119.0 by one-stage synthasal assay. A total of 28 participants, 62%, received glucocorticoids for increased aminotransferase levels or decreased factor IX levels, or both, starting between 11 and 123 days. No infusion-related serious adverse events, thrombotic events, development of factor IX inhibitors, or malignant conditions were observed. Conclusions. Fidanacogene Elaparvovec was superior to prophylaxis for the treatment of participants with Hemophilia B, leading to reduced bleeding and stable factor IX expression. Phase 2 trial of anti-TL1A monoclonal antibody tulisokibart for ulcerative colitis. Background. Tulisokibart is a tumor necrosis factor like cytokine 1A, TL1A, monoclonal antibody in development for the treatment of moderately to severely active ulcerative colitis. A genetic-based diagnostic test was designed to identify patients with an increased likelihood of response. Results. In Cohort 1, a total of 135 patients underwent randomization. A significantly higher percentage of patients who received tulisokibart had clinical remission than those who received placebo, 26% versus 1%, difference, 25 percentage points, 95% confidence interval, CI, 14 to 37, p less than 0.001. In Cohort 2, a total of 43 patients underwent randomization. A total of 75 patients, with a positive test for likelihood of response, underwent randomization across both cohorts. Among patients with a positive test for likelihood of response, Cohorts 1 and 2 combined, clinical remission occurred in a higher percentage of patients who received tulisokibart than in those who received placebo, 32% versus 11%, difference, 21 percentage points, 95% CI, 2 to 38, p equals 0.02. Among all the enrolled patients, the incidence of adverse events was similar in the tulisokibart and placebo groups. Most adverse events were mild to moderate in severity. Conclusions. In this short-term trial, tulisokibart was more effective than placebo in inducing clinical remission in patients with moderately to severely active ulcerative colitis. Next, we will be discussing Articles from Journal of American Medical Association Fever Prevention in Patients with Acute Vascular Brain Injury, the INTREPID Randomized Clinical Trial. Is an automated surface temperature management device effective in prevention of fever in patients with acute vascular brain injury? And does it improve functional outcomes compared with standard fever care? Findings. In this randomized clinical trial of 677 critically ill patients with stroke, temperature modulation significantly reduced daily mean fever burden compared with standard fever care, 0.37 degrees Celsius hour versus 0.73 degrees Celsius hour, but there was no significant difference in functional outcomes at 3 months, meaning fever prevention in patients with acute vascular brain injury using an automated surface temperature management device reduced fever burden but did not improve functional outcomes. Thrombectomy for stroke with large infarct on non-contrast CT. The Tesla randomized clinical trial. Question. Does endovascular thrombectomy improve functional outcome in patients with a large infarct on non-contrast computed tomographic (CT) scan within 24 hours of stroke onset? Findings. In this randomized trial of 300 patients, thrombectomy did not significantly improve 90-day functional outcome compared with medical management alone for the primary endpoint. Adjusted difference in utility, weighted modified Rankin scale score, 0.63. Meaning among patients with large infarct detected by non-contrast CT and presenting within 24 hours, thrombectomy did not significantly improve functional outcome at 90 days. Malaria rapid tests, febrile illness management, and child mortality across sub-Saharan African countries. Question. How has the wide-scale distribution of rapid diagnostic tests for malaria across sub-Saharan African countries affected febrile illness management and mortality for children younger than 5 years of age? Findings. Increasing distribution of rapid diagnostic tests for malaria was associated with increased blood testing, use of antimalarial drugs, and antibiotic use and modestly improved child survival. The greatest benefits occurred in areas with a high prevalence of malaria, meaning the distribution of rapid diagnostic tests for malaria was associated with changes in pediatric febrile illness management and improved survival. Next, we will be discussing articles from Annals of Internal Medicine. Severe maternal and neonatal morbidity among gestational carriers, a cohort study. Background. Use of a gestational surrogate carrier is increasingly common. Risk for maternal and neonatal adversity is largely unknown in this birthing population. Results. Of all eligible singleton births, 846,124, 97.6%, were by unassisted conception, 16,087, 1.8%, by IVF, and 806, 0.1%, by gestational carriage. Respective risks for SMM were 2.3%, 4.3%, and 7.8%. The WRS were 3.30, 95% CI, 2.59 to 4.20. Comparing gestational carriage with unassisted conception and 1.86, CI, 1.36 to 2.55, comparing gestational carriage with IVF. Respective risks for SNM were 5.9%, 8.9%, and 6.6%, generating WRS of 1.20, CI, 0.92 to 1.55, for gestational carriage versus unassisted conception and 0.81, CI, 0.61 to 1.08, for gestational carriage versus IVF. Hypertensive disorders, postpartum hemorrhage, and preterm birth at less than 37 weeks were also significantly higher contrasting gestational carriers to either comparison group. Conclusion. Among singleton births of more than 20 weeks gestation, a higher risk for SMM and adverse pregnancy outcomes was seen among gestational carriers, compared with women who conceived with and without assistance. Although gestational carriage was associated with preterm birth, there was less clear evidence of severe neonatal morbidity. Potential mechanisms for higher maternal morbidity among gestational carriers require elucidation, alongside developing special care plans for gestational carriers. Next, we will be discussing articles from British Medical Journal. Model of integrated mental health video consultations for people with depression or anxiety in primary care. Objective: to evaluate whether an integrated mental health video consultation approach, PROVIDE model, can improve symptoms compared with usual care in adults with depression and anxiety disorders attending primary care. Intervention: participants were randomized 1:1 to receive the PROVIDE model, N equals 187, or usual care, N equals 189. Usual care was provided by GPs through interventions such as brief counseling and psychotropic medication prescriptions, and may or may not have included referrals to mental health specialists. The PROVIDE model comprised transdiagnostic treatment provided through 5 real-time video sessions between the patient at the primary care practice and a mental health specialist at an off-site location. Results: between March 24, 2020 and November 23, 2021, 376 patients were randomized into treatment groups. Mean age was 45 years, standard deviation, SD, 14, 63% of the participants were female, and mean PHQ-ADS score was 26 points, SD 7.6. Compared with usual care, the PROVIDE intervention led to improvements in severity of depressive and anxiety symptom. Adjusted mean change difference in the PHQ-ADS score, minus 2.4 points, 95% confidence interval, minus 4.5 to minus 0.4, p equals 0.02, at 6 months. The effects were sustained at 12 months, minus 2.9, minus 5.0, to minus 0.7, p less than 0.01. No serious adverse events were reported in either group. Conclusions: through relatively low-intensity treatment, the PROVIDE model led to a decrease in depressive and anxiety symptoms, with small effects in the short and long term. Depression and anxiety disorders are prevalent, and therefore the small effect might cumulatively impact on population health in this population. Next, we will be discussing articles from Lancet. Mineralocorticoid receptor antagonists in heart failure, an individual patient-level meta-analysis. Background: mineralocorticoid receptor antagonists, MRAs, reduce hospitalizations and death in patients with heart failure and reduced ejection fraction, HFrEF, but the benefit in patients with heart failure and mildly reduced ejection fraction, HFrEF, or heart failure and preserved ejection fraction, HFpEF, is unclear. We evaluated the effect of MRAs in 4 trials that enrolled patients with heart failure across the range of ejection fraction. Findings: 13,846 patients were included in the 4 trials. MRAs reduced the risk of cardiovascular death or heart failure hospitalization. Hazard ratio, 0,77, 95% CI 0,72, to 0,83. There was a statistically significant interaction by trials and treatment, P for interaction equals 0,0012. Due to the greater efficacy in HFrEF, 0,66, 0,59 to 0,73, compared with HFmFreF, or HFpEF, 0,87, 0,79 to 0,95. We observed significant reductions in heart failure hospitalization in the HAF trials, 0,63, 0,55 to 0,72, and the HFmREF, or HFpEF trials, 0,82, 0,74 to 0,91. The same pattern was observed for total heart failure hospitalizations, with or without cardiovascular death. Cardiovascular death was reduced in the HFrEF trials, 0,72, 0,63 to 0,82, but not in the HFmREF, or HFpEF trials, 0,92, 0,80 to 1,05. All-cause death was also reduced in the HFrEF trials, 0,73, 0,65 to 0,83, but not in the HFmEF, or HFpEF trials, 0,94, 0,85 to 1 ml/03. With an MRA, the risk of hyperkalemia was doubled compared with placebo. Odds ratio, 2 ml/27, 95%, CI 2 ml/02 to 2 ml/56, but the incidence of serious hyperkalemia, serum potassium greater than 6 ml/0 mmol/L, was low, 2 ml/9% versus 1 ml/4%. The risk of hypokalemia, potassium less than 3 ml/5 mmol/L, was halved, 0 ml/51, 0 ml/45, to 0 ml/57, 7% versus 14%. Interpretation. Steroidal MRAs reduce the risk of cardiovascular death or heart failure. Hospitalization in patients with HFrEF and nonsteroidal MRAs reduce this risk in patients with HFmFrEF or HFpEF. Here are the articles from Journal of Hepatology. B-cell characteristics define HCV reinfection outcome. Protection from persistent reinfection was associated with expansion of E2 specific B cells upon reinfection. E2 specific B cells have a transcriptomic profile associated with activation and proliferation prior to clearance of reinfection. We observed evidence of antigen imprinting in HCV reinfection. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Gut microbiota-derived butyrate induces epigenetic and metabolic reprogramming in myeloid-derived suppressor cells to alleviate primary biliary cholangitis. Background and aims. Gut dysbiosis and myeloid-derived suppressor cells, MDSCs, are implicated in primary biliary cholangitis, PBC, pathogenesis. However, it remains unknown whether gut microbiota or their metabolites can modulate MDSC's homeostasis to rectify immune dysregulation in PBC. Results. Decreased butyrate levels and defective MDSC function were found in patients with incomplete response to ursodeoxycholic acid, compared with those with adequate response. Butyrate-induced expansion and suppressive activity of MDSCs in a manner dependent on PERD-driven fatty acid beta oxidation, FAO. Pharmaceutical inhibition or genetic knockdown of the FAO rate-limiting gene CPT1A abolished the effect of butyrate. Furthermore, butyrate inhibited DAC3 function, leading to enhanced acetylation of lysine 27 on histone H3 at promoter regions of PERD and FAO genes in MDSCs. Therapeutically, butyrate administration alleviated immune-mediated cholangitis in mice via MDSCs, and adoptive transfer of butyrate-treated MDSCs also displayed protective efficacy. Importantly, reduced expression of FAO genes and impaired mitochondrial physiology were detected in MDSCs from ursodeoxycholic acid non-responders, and their impaired suppressive function was restored by butyrate. Conclusions. We identify a critical role for butyrate in modulation of MDSC homeostasis. By orchestrating epigenetic and metabolic crosstalk, proposing a novel therapeutic strategy for treating PBC. Here are the articles from Clinical Gastroenterology. Efficacy and safety of vedolizumab and tumor necrosis factor inhibitors in the treatment of steroid-refractory microscopic colitis, a systematic review and meta-analysis. Background. Tumor necrosis factor, TNF-alpha, inhibitors, and the alpha-4 beta-7 integrin antagonist, vedolizumab, have been investigated as treatment options for patients with steroid-refractory microscopic colitis. Conclusion. Vedolizumab and anti-TNF-alpha agents demonstrated a clinical benefit in the treatment of steroid-refractory microscopic colitis, and with a tolerable safety profile. Future randomized controlled trials are needed to compare vedolizumab with TNF-alpha inhibitors and examine treatment effect on patients' quality of life. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Drivers of geographic patterns in outpatient antibiotic prescribing in the United States. In a retrospective, ecological analysis of U.S. medical claims, visit rates explained more of the geographic variation in outpatient antibiotic prescribing rates than per visit prescribing. Efforts to reduce antibiotic use may benefit from addressing the factors that drive higher rates of outpatient visits, in addition to continued focus on stewardship. The second article is Nosocomial Infections in Adults Receiving Extracorporeal Membrane Oxygenation, a review for infectious diseases clinicians. Over the past 10 years, there has been a rapid expansion in the use of extracorporeal membrane oxygenation, ECMO, in the care of patients with refractory cardiac or respiratory failure. Infectious diseases clinicians must reconcile conflicting evidence from limited studies as they develop practices at their own institutions, which has resulted in considerably different practices globally. This review describes infection control and prevention, as well as antimicrobial prophylaxis strategies in this population. Data on diagnostics and treatment for patients receiving ECMO, with a focus on diagnostic and antimicrobial stewardship, is then examined. This review summarizes gaps in the current ECMO literature and proposes future needs, including developing clear definitions for infections and encouraging transparent reporting of practices at individual facilities in future clinical trials. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Prevalence and risk of immunostimulatory herbal supplement treatment among autoimmune dermatology patients. Objective: we assess the prevalence and patterns of herbal supplement treatment among patients with autoimmune skin diseases, particularly dermatomyositis, DM, and cutaneous lupus erythematosus, CLE, and identify commonly taken supplements and their associated risks. Conclusion: herbal supplement treatment is prevalent among patients with autoimmune skin diseases, with immunostimulatory supplements posing a significant risk for immune dysregulation, particularly in DM. Providers should proactively screen and counsel patients regarding treatment with these supplements. Next, we will be discussing articles in the field of cardiology. Mineralocorticoid receptor antagonism prevents aortic plaque progression and reduces left ventricular mass and fibrosis in patients with type 2 diabetes and chronic kidney disease, the MAGMA trial. Background: persistent mineralocorticoid receptor activation is a pathologic response in type 2 diabetes and chronic kidney disease, whereas mineralocorticoid receptor antagonists are beneficial in reducing cardiovascular complications. Direct mechanistic pathways for these effects in humans are lacking. Conclusions: among patients with diabetes with moderate to severe chronic kidney disease at elevated cardiovascular risk, treatment with spironolactone prevented progression of aortic wall volume and resulted in regression of LV mass and favorable alterations in native T1, suggesting amelioration of left ventricular fibrosis. Here are the articles from journals of the American College of Cardiology. Antithrombotic strategies in atrial fibrillation after ACS and/or PCI, a four-way comparison, from Augustus. Background: the optimal antithrombotic regimen for patients with atrial fibrillation, AF, who had an acute coronary syndrome, ACS, or have undergone percutaneous coronary intervention, PCI, is not known. Conclusions: in patients with AF and a recent ACS and/or PCI, an antithrombotic regimen that included a P2Y12 inhibitor and apixaban without aspirin resulted in a lower incidence of the composite of death, bleeding, or cardiovascular hospitalization than regimens including VKA, aspirin, or both. From JAMA Cardiology. Plasma proteomics of exercise blood pressure and incident hypertension. Question: are plasma protein markers of exercise blood pressure, EBP, also associated with incident hypertension? Findings: in the Health, Risk Factors, Exercise Training and Genetics, Heritage, Family Study, Plasma levels of TGF-br3 were inversely associated with EBP, interrogation of TGF-br3 among individuals without hypertension from the Framingham Heart Study, Jackson Heart Study, and the multi-ethnic study of atherosclerosis, demonstrated that TGF-br3 is a novel circulating biomarker associated with a lower risk of incident hypertension. Genetically predicted levels of TGF-br3 were inversely associated with hypertension and cardiovascular disease, CVD, meaning circulating TGF-br3. A marker of EBP was inversely associated with future hypertension risk in a diverse population and may protect against the development of CVD. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. The Spectrum of Dysregulated Aldosterone Production, an International Human Physiology Study. Context. Primary aldosteronism is a form of low renin hypertension characterized by dysregulated aldosterone production. Objective: to investigate the contributions of renin-independent aldosteronism and ACTH-mediated aldosteronism in individuals with a low renin phenotype, representing the entire continuum of blood pressure. Conclusion: in the context of a low renin phenotype, there is a continuum of primary aldosteronism and dysregulated aldosterone production that is prominently influenced by ACTH. A large proportion of individuals with low renin may benefit from aldosterone-directed therapy. Here are the articles from Diabetes Care. Effectiveness of multi-level and multi-domain interventions to improve glycemic control in U.S. racial and ethnic minority populations, a systematic review and meta-analysis. Background: racial and ethnic disparities in type 2 diabetes outcomes are a major public health concern. Interventions targeting multiple barriers may help address disparities. Conclusions: multi-level and multi-domain DSME interventions had a modest impact on HbA1c. Few DSME trials have targeted the community and society levels or physical environment domain. Future research is needed to evaluate the effects of these interventions on outcomes beyond HbA1c. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Graded multidimensional clinical and radiologic variation in patients with Alzheimer's disease and posterior cortical atrophy. Background and objectives. Alzheimer's disease, AD, spans heterogeneous typical and atypical phenotypes. Posterior cortical atrophy, PCA, is a striking example, characterized by prominent impairment in visual and other posterior functions, in contrast to typical amnestic AD. The primary study objective was to establish how the similarities and differences of cognition and brain volumes within AD and PCA, and by extension other AD variants, can be conceptualized as systematic variations across a transdiagnostic, graded multidimensional space. Discussion. These results provide evidence supporting a reconceptualization of clinical and radiologic variation in these heterogeneous AD phenotypes as being a long-shared phenotypic continuous spanning PCA and AD, arising from systematic graded variations within a transdiagnostic, multidimensional neurocognitive geometry. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Changes in spirometry interpretative strategies. Background. Recent guidelines for spirometry interpretation recommend both race-neutral reference equations and use of z-score thresholds to define severity of airflow obstruction. Research question: how does the transition from race-specific to race-neutral equations impact severity classifications for patients with COPD when using percent predicted versus z-score thresholds? And do changes in severity correspond to clinical risk? Interpretation. The proportions of black and white individuals reclassified were similar with z-score thresholds, and changes in severity corresponded to clinical risk with z-scores. These results support recent recommendations for use of race-neutral equations and Z-score thresholds for spirometry interpretation. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Physiologic effects of extracorporeal membrane oxygenation in patients with severe acute respiratory distress syndrome. Rationale: blood flow rate affects mixed venous oxygenation, FCO2, during veno-venous extracorporeal membrane oxygenation, ECMO, with possible effects on the pulmonary circulation and the right heart function. Objectives: to describe the physiologic effects of different levels of ZOV2 obtained by changing ECMO blood flow in patients with severe acute respiratory distress syndrome, receiving ECMO and controlled mechanical ventilation. Conclusions: in patients with severe acute respiratory distress syndrome, increased ECMO blood flow rate, resulting in higher ZFO2, decreases pulmonary artery pressure, cardiac output, and right heart workload. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. A 6-year follow-up of bloodstream infections in hemodialysis facilities in the United States, National Healthcare Safety Network, 2020. Key points. In 2020, 7,183 hemodialysis facilities in the United States reported bloodstream infection data for over 5 million patient months to the Centers for Disease Control and Prevention's National Healthcare Safety Network. Pooled mean bloodstream infection rates per 100 patient months ranged from 0.12 among patients with arteriovenous fistulas to 0.80 among patients with central venous catheters. Rates of bloodstream infection were lower than predicted overall, and in almost all states and territories. Here are the articles from Kidney International Reports. Global AHAS Registry Analysis of Patients Switching to Ravulizumab from Eculizumab. Introduction. Atypical hemolytic uremic syndrome, AS, is a progressive rare disease that, if untreated, can result in severe organ damage and death. Ravulizumab, a next-generation terminal complement inhibitor, provides immediate, complete, and sustained complement C5 inhibition. Real-world data in patients with AS who switched to ravulizumab from eculizumab are lacking. Conclusion. This is the first real-world cohort analysis of data from patients treated with ravulizumab, and reinforces the real-world safety and effectiveness data of ravulizumab in patients with AS who switched from eculizumab.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.